Next question from Tom Connell.
Thanks, Mr Pearson. Tom Connell from Sky News. When people buttonhole me about The Voice, which is mainly friends and family, but the odd stranger, they're generally open to the idea that things need to change. Their question is usually, well, how does The Voice help? So I'd like to ask you that in regards to rheumatic heart disease, which you raised.
Yeah.
Clearly it's a problem. Clearly it's a problem quite particular to First Australians as well.
Yeah.
And we do have a national strategy. We do have a state, a Queensland strategy as well to eradicate it. So how does A Voice do better than what's already happening? Clearly politicians agree it's a problem. People like you are trying to be the voice for it. What changes about it, an Indigenous voice to Parliament about that particular issue?
Well, think about the relative focus, right? What if it was the situation that 2 people were dying every week in custody? What would be the state of debate? And yet these children and young people have been dying at the rate of 2 per week, and the doctors are telling the numbers are going up. And so in order to lift the focus on rheumatic heart disease from managing a problem over the years to one of we need a full court press in order to eradicate the disease, we need a voice. It hasn't happened. The experts that we spoke to yesterday in Brisbane said it's not happening. There's 3 paediatric cardiologists north of the Brisbane line, and yet 90+% of this problem is north of the Brisbane line. South of that line, there's something like 50 experts in this area in the medical profession in Australia. We have got to direct more resources into those parts of Australia where this disease is rife, and we're nowhere near eradicating it.
So is that a funding change? Would that be one of the key?
That's partly it. It's also absolutely focusing, getting governments, state and federal, to focus on providing the professionals we need. This is a multifaceted problem. It's about home hygiene as well, housing, overcrowding. It's got to be tackled from many directions, but what we do know, it is solvable. You can eradicate. Australia eradicated it in the 1950s. We can do it. It's just we need a focus on it. Our local member didn't talk about it for 26 years, and yet it's a primary problem for his constituents. So I would expect that The Voice would be on to problems like this and ensure that the ears of government and Parliament were constantly hearing the advocacy on behalf of the children.